Good morning.
Hey, Nancy, welcome. I see Angelica just joined. And it looks like there are 2 or 3 callers on the phone. If you're on the phone, do you mind just letting us know who you are?
This is Suzanne. I've called in. Fantastic. I'm calling in. People are going to have to mute or you're not going to be able to hear anything.
This is Danielle. I think I should be showing as me, not as a call-in user.
That is true. You're showing as you. Okay. Anybody else on the phone?
I don't know if you heard me, but this is Suzanne. I have called in.
Yes. Okay. Hi, Suzanne. Thank you. There's Caitlin Ryland and Caitlin Brooks. Very good. That's probably enough to open. What do you think?
Can y'all hear me?
Yes. Okay. We can hear you.
Nice.
Okay. So, Danielle, are you also calling in on your phone?
Sorry, I always forget to unmute myself. I get a lot of feedback when I try to do it on my computer, so I call in, but if you use the ID number, it's supposed to tie you. So I'm supposed to not be showing as a call-in user, which I don't think I am. I don't see any sound by any of these as I'm talking.
That's true. Okay, then we have 2 more people that are on by phone, and that could be Carl even, because he was going to call in for the presentation part. Carl, are you on?
Yes, ma'am, I am.
Ah, thank you.
Pam Cashwell is on by phone.
Wonderful. Thank you. Okay. I'm going to start this recording. Okay. Hi, Judge Elliott.
Hi, good morning. Can y'all hear me?
Yes.
You broke up there.
For recessing briefly to join us.
Not an issue.
Okay. Can everyone hear me and can everyone hear Christine okay?
Mm-hmm.
Yes. Yes.
Okay. Okay. Well, it's 10:02 and I think we have almost everyone on the call. So I'll go ahead and call the meeting to order.
I can't
thank you all for
get my video to share.
I just want to remind everyone, if you're not speaking, to mute. I think we've all heard that a million times over the last 3 or 4 months. But again, welcome to the meeting and thank you for setting some time aside today to get together. I know I would love to see everyone in person, and that's just not possible right now. So this is the best we can do, and there are some different procedures that we'll go through today just because of public meeting law and things like that. But the very first thing I want to do is I am excited to announce that we have 2 new appointments to the commission. We have Tammy Harris and we have Dina Joy, who have been appointed to the commission, and we have Judge Elliott, who is going to virtually perform their swearing-in ceremony this morning. And Judge Elliott, we really appreciate you just taking a few minutes out of your schedule to do this for us. So why don't we start with Tammy?
All right. Judge Elliott, are you still there?
hear me? Okay, so Tammy, do you have your Bible with you?
I do.
Okay, if you'll put your left hand on your Bible,
Okay.
you can raise your right.
Okay.
All right, and if you'll repeat after me, I state your name,
I, Tammy Harris,
do solemnly swear
do solemnly swear
that I will support the Constitution
that I will support the Constitution
of the United States.
of the United States.
I state your name,
I, Tammy Harris,
do solemnly swear
do solemnly swear
that I will be faithful. I will be faithful
that I will be faithful
and bear true allegiance
and bear true allegiance
to the state of North Carolina.
to North Carolina
Yes. And to the constitutional powers
and to the constitutional powers
and authorities which are or may be established
or may be established
for the government thereof,
for the thereof,
and that I will endeavor to support,
endeavor to support,
maintain, and defend the Constitution of said state,
the Constitution of said state,
not inconsistent with
not inconsistent with
the Constitution of the United States.
the Constitution of the United States.
I state your name,
I, Tammy Harris,
do solemnly swear
do solemnly swear
that I will well and truly execute
that I will well and truly execute
the duties of my office
the duties of my office
as a member
as a member
of the North Carolina Human Trafficking Commission
of the North Carolina Human Trafficking Commission
according to the best of my skill and ability,
to the best of my skill and ability,
according to law,
according to law,
so help me God.
so help me God.
All right, congratulations.
Thank you so much.
Thank
Thank you.
you.
Appreciate it.
There's a little bit of a lag, so I apologize. Hopefully they're catching it. So is Dina with us? Dina Joy?
I am. I can't get my computer to work. Can you hear, or my video to work? Can you hear me?
Yes, I can hear you fine. So are you ready to take the oath?
Yes, ma'am.
Okay, if you'll just repeat after me, please.
Yes, ma'am.
I state your name.
Dina Joy. I, Dina Joy,
Do solemnly swear
solemnly swear
that I will support the Constitution of the United States.
that I will support the Constitution of the United States.
I state your name.
I, Dina Joy,
Do solemnly swear
do solemnly swear
that I will be faithful
that I will be faithful
and bear true allegiance to the state of North Carolina
and bear true allegiance to the state of North Carolina
and to the constitutional powers
and to the constitutional powers
and authorities which are or may be established for the government thereof,
or may be established for the government thereof,
and that I will endeavor to support, maintain, and defend
and that I will endeavor to support, maintain, and defend
the Constitution of said state,
the Constitution of said state,
not inconsistent with the Constitution of the United States.
not inconsistent with the Constitution of the United States.
I state your name.
I, Dina Joy,
Do solemnly swear
do solemnly swear
that I will well and truly execute
that I will well and truly execute
the duties of my office
the duties of my office
as a member of the North Carolina Human Trafficking Commission
as a member of the North Carolina Human Trafficking Commission
according to the best of my skill and ability,
according to the best of my skill and ability,
according to the law,
according to the law,
so help me God.
so help me God.
All right, congratulations.
Thank you.
Congratulations. Hey.
Well, that's if you're at first. Yep, we're unmuted.
Okay. Judge Elliott, thank you so much.
No, thank you. And I'm sorry I can't stay for the rest of the meeting. But I'm going to jump back into court and see if I can get this custody case finished today. So,
Good.
and I'll scan these in and send them to you, and then I'll put the originals in the mail.
Thank you.
Thanks.
Have a great day.
Thank you.
Okay, Tammy and Dina, congratulations again and welcome to the commission. In just a few minutes, I'll have you all just get a little bit more of an introduction for each of you, but just to go through a couple of things that we need to do first, I'm going to read the ethics reminder. In accordance with the State Government Ethics Act, it is the duty of every North Carolina Human Trafficking Commission member to avoid conflicts of interest. If any HTC member has any known conflict of interest with respect to any matter coming before the Human Trafficking Commission today, please identify the conflict and refrain from any participation in the particular matter involved. And in line with that, for our two new members, we also are required to read into the records the evaluation from the State Ethics Commission for each of our new members. So I'm going to start with Tammy's, and I'm just going to read directly from the evaluation. Our office has received Ms. Tammy Harris's 2020 Statement of Economic Interest as an appointee to the North Carolina Human Trafficking Commission. We have reviewed it for actual and potential conflicts of interest pursuant to Chapter 138A of the North Carolina General Statutes, also known as the State Government Ethics Act. We did not find an actual conflict of interest, but found the potential for a conflict of interest. The potential conflict identified does not prohibit service on this entity. Ms. Harris fills the role of a member who is affiliated with a faith-based shelter or benefits organization that provides services to victims of human trafficking. She is the founder and executive director of the Ursus Institute, an organization that works to combat human trafficking, and the Voice of Hope International, which helps find care and housing for victims of human trafficking. Because Ursus Institute or the Voice of Hope International could benefit from grant funding awarded by the Commission, she has the potential for a conflict of interest. Accordingly, Ms. Harris should exercise appropriate caution in the performance of her duties should issues involving the Ursus Institute or the Voice of Hope International come before the Commission for official action. And this is the evaluation for Dina Joy. Our office has received Ms. Dina Joy's 2020 Statement of Economic Interest as an appointee to the North Carolina Human Trafficking Commission. We have reviewed it for actual and potential conflicts of interest pursuant to Chapter 138A of the North Carolina General Statutes, also known as the State Government Ethics Act. We did not find an actual conflict of interest, but found the potential for a conflict of interest. The potential conflict identified does not prohibit service on this entity. Ms. Joy fills the role of an at-large member on the Commission. She is the executive director of the Children's Advocacy Centers of North Carolina, Incorporated, a state chapter of the National Children's Alliance. Because CACNC has a network of nonprofits, including ones that serve child and adult survivors of human trafficking, she has the potential for a conflict of interest. Therefore, Ms. Joy should exercise appropriate caution in the performance of her public duties should entities within the accredited CACNC network come before the Commission for official action. So, that being checked off the list, one kind of new thing that we're going to have to do here in the virtual setting is normally with the in-person meetings, we would all sign the sign-in sheet. But because of the situation we're in today, I'm going to call the roll. So before I call the full roll, I would just like to ask Tammy and Dina just to introduce themselves to the commission and just share a little bit about your backgrounds and your work with human trafficking. And Tammy, we'll start with you.
Okay. Thank you so much for having me. I'm so honored to be a part of the commission, so thank you again. I'm originally from Pennsylvania. Was first in marketing, a master's in education, undergrad in marketing. I started my work in anti-human trafficking about 5 years ago, I'd say. It's a different nonprofit that's housing and restoration for adult female victims of trafficking. And it was in this work that I started to see areas in the anti-human trafficking community that were not being the need for unbiased data, the need for transitional housing after someone goes through restoration as that next step for reacclimation, more education in the community, various niches that really I thought needed more attention, legislation input as from someone who works directly with victims. So that is why I started the Ursus Institute. We have a transition opening in Charlotte. Our first survivor is from the Fayetteville area. We are working on an application that the MVP should be ready soon for demonstration. And we do intel and rescue in the Dominican Republic, educational things within the community, and we're working with Representative Jake Johnson right now on some legislative pieces. So thank you once again.
Thanks, Tammy. Dina, do you mind just sharing a little bit about yourself?
Absolutely. I am Dina Joy. I'm the current Executive Director of Children's Advocacy Centers of North Carolina. And so we're responsible for the training and technical assistance and ensuring adequate service provision that meet the 10 accreditation standards for the 47 children's advocacy centers across the state of North Carolina. Prior to that, I actually ran a children's advocacy center and sexual assault center in Alamance County. And my work with human trafficking has been done mostly with Project No Rest, and then working alongside of Libby Coles as well as Christine, just through work that the commission was doing in joint with CAC-NC, NC CASA, NCC-ADV, and NC VAN.
Okay, great. Thank you. Thank you, Dina, and thank you, Tammy, for volunteering to serve on the commission. We're really excited to work together as we move ahead. So I'm going to go ahead and call the roll. And what I'm just going to ask you to do is say, recognize either here or present, and just state who you're representing. Tommy Bernard.
I'm here. So I am a physician at Wake Med, and I'm representing, I'm on Shield, North Carolina. My wife runs Shield, North Carolina, and I'm medical representative as well. I'm public health committee chair as well.
Thanks, Dr. Bernard. Caitlin Brooks. And don't forget to unmute.
Sorry, can you hear me?
Yeah.
Okay, yes, I'm here and I represent public at large, and I'm the legislative committee chair.
Pam Cashwell. Pam, are you there? You may be muted. Okay, we'll come back. Danielle Carmen.
Hi, I'm here. I am the Deputy Director at the North Carolina Administrative Office of the Courts, and I'm the Judicial Branch's ex officio representative on this commission.
And we met Judge Elliott earlier. I'm here. Tammy Harris, thank you. Judge Claire Hill.
Good morning. I am Judge Claire Hill. I am an ex officio member representing the Conference of Superior Court Judges, serving for the president of our conference.
Thank you. Dina Joy, again, thank you. Jasmine McGee.
Present. I'm Jasmine McGee, Director of Public Protection at the North Carolina Department of Justice.
Thanks, Jasmine. Mark Nichols.
Can you hear me?
I can hear you.
All right. Mark Nichols, I'm one of the special deputies for Johnston County Sheriffs and represent the sheriffs and the Senate, Senator Berger for North Carolina. And I'm glad to be here and see everyone this morning.
Me too. Caitlin Ryland.
Hi, I represent Legal Aid of North Carolina.
Thanks, Caitlin. Suzanne Monty Smith. Suzanne, I think you were there. You might be muted. I'll come back to you. Billy West.
This is Billy West. I'm the Cumberland County District Attorney representing the North Carolina Conference of District Attorneys.
Thank you. Angelica Wind.
Oh, great. Hi, I'm Angelica Wynn, and I'm the Executive Director of Our Voice. I am serving as the North Carolina Coalition Against Human Trafficking's seat. I serve as the Vice Chair of NCCAP.
Wonderful, thank you. And just we'll come back one more time. Pam Cashwell, are you there? No, okay. She may have dropped off. And Suzanne. Suzanne, are you there? Okay. We had you earlier. Maybe you'll come back. Okay, we will move on to approving the minutes from the February meeting, which seems like 20 years ago. I think Christine sent these out several days ago. Does anyone have any corrections or changes to the minutes? Okay, seeing none. Again.
Sorry. That was me. It's Pam Cashwell. Sorry. I had my phone on. I could hear you all the whole time. For some reason, when I unmuted, it just didn't unmute. So now I'm at my desk, at my computer, and so I can see you all. Good morning. I'm here. Sorry for all that feedback. I was trying to switch from phone to computer. Sorry about that.
I am really, really disturbed by what you have in the background. Like that whole Carolina basketball thing going on behind you. I'm gonna have to not look at that.
You need me to change my view? Is that better?
Yes, wonderful.
And I'm sorry, this is Suzanne. Somehow I got knocked off the call.
Okay, I knew you were there. So okay, we've got everybody. Wonderful. So again, kind of the clunkiness of holding these meetings virtually. Any matter that we vote on requires a roll call. Fortunately, for this agenda, this is the only item that we have to vote on. So I'm just going to call the roll. We'll move through this as quickly as possible. This is a vote to approve the February minutes. Dr. Bernard?
Approved. No questions.
Caitlin Brooks?
Yes.
Pam Cashwell?
Approve.
I don't think I'm supposed to vote, am I, as an ex officio member?
Thanks, Danielle. Good call. I'm a yes. Tammy Harris.
Am I allowed to approve? Because it's from February?
We will, for Tammy and Dina will abstain. We have enough members present for a quorum. Jasmine McGee.
Aye.
Mark Nichols.
Yes.
Caitlin Ryland.
Approve.
Suzanne Smith.
Approved.
Billy West.
Approved.
Angelica Wins.
Approved.
Okay, the minutes for February are approved. We will go ahead and move on. Next thing on our agenda is chair remarks. I don't have a long report. First of all, since we welcomed Dina and Tammy this morning, they are filling the seats for Libby Coles and Monica Johnson. Monica was supposed to be joining us this morning, but she had a last minute appointment otherwise. And even though she's not here, I do just want to publicly thank Monica for her service on the commission, for her service with the Standards Committee. And I really hope that Monica will be able to continue working on the Standards Committee as a member of that committee. I think we've all heard this is just a strange time. It seems like it's been 20 years since we met in February and saw each other in person. I think as soon as kind of the calendar flipped over to March, we had been having a lot of good forward progress with a lot of our committees, with a lot of the commission work. And I think as soon as the calendar turned into March, you know, some of the work we were doing just sort of had to be shifted to the back burner. But I am excited that as we start moving into the summer, our committees are meeting again. We're getting back to work. I'm excited about some of the things we have going on. I'm excited about our committees. Christine is going to share some exciting information, which you all mainly already know about. Nancy Hagan joining the staff here at the Human Trafficking Commission, and about several interns that we have that are helping our committees, that are helping Christine as we really start kind of focusing again on the work that we're doing here. One thing that Christine had worked on scheduling before all of this was the Human Trafficking 101. Since we have so many new commission members, I believe that had been scheduled, and then we had to cancel it when COVID presented itself. So one thing we're working on now is rescheduling a time for Human Trafficking 101, just to for all of our new members and for any of our members really who want to take part in that. And then finally, I really want to thank Christine, because she has kind of kept the wheels on the bus as we have gone through all this. And she has, as have many people, been dealing with kind of the burdens of how this has affected personal life and home life and homeschooling. And but Christine has done great work for us during this time, and I want to thank her for that, and just for kind of keeping all this stuff going. And hopefully we have some sort of lights at the end of the tunnel, some hope. So I'm just excited for the work that we have going forward, and I think that is kind of a good segue into the next item on our agenda is to hear committee reports and to hear from the chairs of each of our committees about the work that they have going on right now. So we'll start with the legislative working group and Caitlin Brooks. Caitlin, can you share what's going on your end?
I can. Can you guys hear me?
Yes.
Okay. Great. Well, I have a couple of different things to go through. We'll start with just kind of where we are right now. We have House Bill 1095 was filed on May 14th. That was done in the House by Representative Bowles, Davis, and McNeil. It was immediately referred to Appropriations with serial referral to the rules. It's currently still parked in Appropriations. It gave us recurring funding, $250,000, or would potentially, of course, for our executive director position and for operating costs. And it also put in some clarifying language regarding, I actually am not familiar with this, so if anybody knows why this was in there, I would love to hear. It's about the confidential files that are maintained electronically regarding expunction of records for certain offenses committed by human trafficking victims. That piece right there, 15A 145.9, is the part that they clarified. You know, I don't know if that has any if anybody knows what the history of that is or not, but I'm not familiar with it.
I was not either.
Okay. So
Caitlin,
yes.
may I ask a question? Can you tell me the House bill number again for that?
Yes, it's 1095.
Thanks.
You're welcome. So yeah, that's just currently parked. We've been in contact with the House and Senate, just asking them to support this recurring funding because, of course, as we all know, we really need it to actually be able to function and operate. Other than that, I'm not aware of any other kind of leads we have. Is anybody aware of anything?
I mean, just in general, I'm aware that it looks like whatever current session we're in may be wrapping as soon as today.
Yeah, today or tomorrow is what I've heard, which doesn't sound great for us, but yeah.
Well, and I think, you know, they've been in session since like mid-May. And I think kind of the primary, they basically came in to do what they had to do regarding the budgetary needs, regarding there's been a lot of policy issues specific to COVID.
Yeah.
They kind of just hit kind of the depending on what your perspective is, the low-hanging fruit and the things that just really needed to be done. And you know, we've just been saying for months now that we're in a really strange budget situation. We've been saying that since last year. Because of COVID, they pushed the tax deadline back to July 15th. So normally the tax deadline would be April 15th, which would have allowed them to create a budget. But given they won't know the exact revenue situation until the middle of July, it's my understanding that they may return after that. So revisit the idea of a short session budget just to see where things actually land. And then I'm also aware that the state is in receipt of several $billion from the federal government. But the problem is that the language in the federal regulation restricts how those funds can be used.
Yeah, it's tied.
Yeah, so right now, the state can only use those funds for direct COVID, for anything directly related to COVID, meaning we can't use it to fill in a revenue hole.
Yeah.
So that's the problem. I think we're still sitting on more than $1 billion in federal money that we don't really know how to use right now. And I think we're hoping that the federal government will revise their regulations on that.
So yeah, that's where that is. Transitioning, I guess we can talk about Madeline. She is one of the interns who started with us about a month ago, and she I have a little blurb on her because I don't think the commission has gotten information about her. Is that right, Christine?
Correct.
Okay. She is starting her second year in Masters of Public Policy program at Duke. While she was in college, she completed a research project with local law enforcement and social workers studying the prevalence of online sex trafficking in Madison, Wisconsin. She also spent a semester abroad studying human trafficking at the international level in Copenhagen. And when she started about a month ago, I think one of the things we really wanted her to look at is just the data that we never really got to sift through from 2018 and 19, the AOC data that we received back in January that we wanted to really analyze, but we just didn't have the time before the awareness month. And so one of the materials that Christine sent out was kind of a 1-pager, 2-pager on some human trafficking charges, just kind of like highlight reel. And so Madeline was going to just briefly explain what she did, where that information came from. I think it's helpful for us to be able to look at it and just look at, where were the top charges, what kind of numbers are we looking at in the state, what counties are the highest, et cetera. And so Madeline was just going to briefly explain that for us.
Yeah, I'll share my screen so that you don't have it in front of you.
Madeline, we can't hear you.
Hear me now?
Yes.
So as I said, I've been looking through the AOC data from 2018 and 2019 and dividing it up into different spreadsheets, looking at it at the county level and at the statute level, with charges that are related to human trafficking. And Caitlin and Christine and I have been having a lot of dialogue about charges to specifically as human trafficking, and other ones just included more related charges. An eye on how the level of those are. So right now we have it as the human trafficking statutes are just the 1443 charges, the trafficking, involuntary, and sexual servitude ones. But I would love to hear from anyone's thoughts on it. Any of the other related charges could be moved up to define as human trafficking. And you can see there are a lot of things that we have under the related charges. The spreadsheet that I have, we also included a lot of other sexual offense charges, particularly relating to minors. Right now, that's where we're at, and I have down here the counties, as Caitlin said, from 2018 and 2019. There's a lot of similarities across the board. The bottom on here just has what I could find on federal trafficking charges, or to know that there were no labor cases in that report, just a few sex trafficking. Caitlin, wanted to hear from everyone if they have any thoughts about what charges to move up under the human trafficking.
Yeah, so one of the things we've talked about a lot in coming up with these, data points is what do you consider to be purely human trafficking, and what is just kind of tangentially related, or it's similar but it's not necessarily. And I think that is, can be really tricky, and that's why sometimes you see a shift in numbers, because it's all dependent on what you include as human trafficking. And Madeline, you looked at the Shared Hope, is that right?
Yes, Shared Hope just only focuses on the minor charges, but they do include the sexual exploitation of a minor within their definition of trafficking, child exploitation.
Does anybody have any thoughts on that? Christine and I have also, I'm sorry, are y'all getting feedback from me?
There is some feedback, but I'm going to everyone else, and maybe that will help.
Okay. Christine and I talked about potentially getting an opinion from the Conference of DAs, or just getting an opinion from someone as to what we would include. I think while it's important to have a disclaimer that these are the statutes we include, I don't necessarily know how important it is what we decide, as long as we explain these are the statutes that we included in the statistics. But I would love to hear anyone's opinion on that.
So Caitlin, this is Tammy. I was involved in a study with UNC, which has to do with They looked at the administrative office of the courts and the charge codes, the arrests, the convictions, and I can share that data with you if you would like me to forward it to you or Madeline. Okay.
I think, and I'll cover this in just a minute, but we also have some Elon Law volunteers for the summer who were displaced from their internships. So yes, if you could send that to me, that would be awesome.
I'll email that to you later today.
Does anyone else have any opinion on the statutes to include? Is the one pager helpful?
It is. This is Mark talking, and Carl Wall, I don't know if you're on the line or not, from our law enforcement side, who is the SBI special agent in charge of the human trafficking for North Carolina. So Carl, I don't know if you can see the one pager or not, but it's a good one sheeter for us. And I certainly want to thank Madeline for your hard work on this. It's not easy finding data. Sometimes it's hidden, and that was very good and welcome aboard as well too. So.
This, as we were talking when Madeline first started, before everything happened with COVID, I had a meeting with the Alamance County Sheriff's Office, and their ADA, who does their human trafficking cases, came to this meeting, and it had me really thinking about, okay, for Alamance County in particular, that their charges versus convictions, they have an ADA that is primarily her role, not an extra thing, not just one of the things she happens to do, but it's one of her primary roles, as she is funded by a grant to do that. And so I just started thinking, well, I wonder if there's a correlation between charges and convictions, and then if we could look and see, are there other ADAs who are funded by grants, or just kind of where and why. And the only way we can start trying to figure that out is if we have data to start with. So
you read our mind. That's what we've been speaking the whole time, Caitlin. So thank you, and Madeline, because we got to have the data to support what we're trying to do, from law enforcement to a prosecution on it. So, and Billy, I know you can comment on that. You have a special team that prosecutes the human trafficking group. So any comments from you?
Yeah, thanks, Mark. I was just getting ready to speak up. Yeah, we have Lindsay Lane, who I believe's listening in this morning as well, and she is on a grant from the Governor's Crime Commission, where she works specifically on human trafficking. And we do have a task force here in Cumberland. And I do think one thing about the numbers that's kind of a positive and a negative at the same time is, Cumberland, we're the 4th or 5th largest area. We have the most cases. While we do have a human trafficking issue here that we're working hard to address and prosecute, that is because we're putting a focus on that area and bringing more charges in that area. So sometimes that's why you see higher numbers in some counties. But I think the sheet looks pretty good. As far as something we've talked about before, when you get into what people are convicted of, sometimes they may be charged with one thing, they may end up pleading guilty as part of a plea arrangement or whatever to some other charges. So that's something to watch out for. But I know I can speak for Lindsay and say she certainly will be whatever help she can to this group. We also have the first human trafficking court here in Cumberland in the state, and one of the first in the nation. But Lindsay does a fantastic job, and she is devoted 100% of her time to human trafficking. And then we have some law enforcement officers and service providers, et cetera, that are also on our task force.
I think that's great. And I know I would, my committee would love to hear from Lindsay and any of her colleagues as we move forward to thinking about what we want our legislative goals to be next year in 21. If we are going to try to make any adjustments, I know that we would definitely appreciate her expertise.
Certainly will offer, she does a lot of presentations and she's got a lot of information. And so I'm sure it'd be very helpful. So we'll line that up, Caitlin, however it works best for you guys.
Okay, that would be awesome. I guess, does anybody else have any comments or want to say anything about the Madeline's one-pager? Two-pager, I guess, technically. Okay, we'll move on. We also have some volunteers, as I mentioned earlier, from Elon Law. Christine was really paying attention and did a great job. They, I guess, had internships already lined up when Elon Law said that they were not allowed to actually go into internships. Some of them dropped from placements. So we have 3 volunteers that are going to be helping us this summer, and they are Amy, Jared, and Barbara, and they are all 2Ls that are looking at public interest law. And we have, Christine and I have kind of broken down 3 different things that we think they could be helpful with to get data. I'm sorry, Danielle, can you hear me? No?
Sorry, that I typed that a while ago, and it was only Madeline. I mean, I don't mean only Madeline, but it was Madeline I couldn't hear.
Oh, okay,
So
okay.
I'm sorry, I missed what you were saying.
Sorry, no, that's okay. So some of the things that each of them will be working on a project. Amy is actually going to be looking at the AOC data and potentially looking back further, 17 and further back, and just again looking at the data and kind of organizing it. So if anybody has, Christine, you had a good example of something that a commissioner asked about a couple meetings ago, that if anybody wants something looked at in particular, it would be great to give that to Amy. Do you remember what the example was, Christine?
I cannot remember what it was. I'm sure I will.
Okay. But if anybody has something that they would like, I remember. It was something that Jasmine had asked about.
Oh, it was kidnapping.
Yeah. It was just an example that we came up with, Jasmine, that you had asked about a couple of meetings ago, that if there are things like that that anyone would like looked into, this would be a great opportunity to have somebody actually answer your question.
Great, awesome.
So that's what Amy will be doing, and her name is Amy Grenner. I'm sorry, I'm probably going to completely mess up your names. Jared Willis is, they're all 2Ls, by the way. He's going to be looking at human trafficking laws. So Madeline has started compiling just what other states are doing. What are they doing well? What are they not doing well? What are recent statutory changes that they've had? And she has a pretty massive document right now that she's not even remotely started whittling down. But Madeline is not as familiar with the statutes because obviously she's not in law school. She's focused on another area. And so Jared is going to be looking at that. And so if anybody has anything that they want to look at in particular in any state, Jared is going to be your point of contact. And I guess at the end of the meeting, Christine, could we send all their contact information out to the full commission so they have it in case they want to reach out directly?
Absolutely. We can do emails, and I'm happy to also kind of correspond and pass things back and forth if needed.
Okay. And then our last volunteer is Barbara Spencer, and she is going to be working on the annual report that we issue. She's going to be just working with us to draft it up and have something ready, hopefully by the end of the summer. Does anybody have any questions about that?
Caitlin Ryland, did you stick your hand up? I can't read these symbols on WebEx.
I do not know.
So other than that, we did have a committee meeting that was scheduled for, now I can't remember when it was, I guess April. That was canceled, obviously. And so we will be planning a WebEx hopefully in July, maybe early August, but hopefully July, to have our committee actually have a meeting. But other than that, I don't have anything else.
Caitlin, that was an awesome report. Thank you for all your work, and Madeline for doing the 1/2 pager. And Amy, Jared, and Barbara, I don't know if they're on the call, but thank you for all of your efforts this summer too. Let's see. Next on our agenda is Mark Nichols with a report from the Public Safety Committee. Mark?
Oh, thank you. Can you hear me okay?
Yep.
All right. Well, again, thanks for everyone for listening and being there this morning. And I'm glad we're having this meeting, Jennifer. It's important to get back to business, even though it's virtual. Absolutely. And thanks, Nancy, for being along with us and joining the group here. And Madeline, very pleased to have you along, and all the interns that are working. Caitlin, that's fantastic. We got some help out there, and we'll take all we can get because we got our hands full, right? Some of the information I want to provide is we're moving along very, very well with our committee. And then we hit the brakes because of COVID-19. And now we're starting to get back and start moving things forward. So we've had a couple calls through this time period just to make sure people were still boots on the ground and what we're hearing and what we're seeing. But from the public safety side, we had some ideas that were in the works basically when all this started. And one of them was a public awareness video that we could use some officials to spread the word to the public and their civilians through North Carolina about human trafficking, and try to get a message that was united, that we could have people, that would resonate with them in the communities. And one of them was to partner with a company that had the DOT grants across the state. So Christine, I don't know if you're beside or close to Jennifer, but we were working with an individual there. But since then, their company was purchased by another engineering firm. So I'm not too sure where that grant is, but there are some other opportunities on grants that we have found, and actually that we had talked to some other friends about. So Christine, I don't know if you're in a position you can comment on some of the grant information for public safety and some of the ideas that we had, but we certainly may still have an opportunity. Is that correct?
I do think yes, I do think we still have plenty of opportunity once things open back up again. And I can tell you one good thing that kind of came out of that. We had started those conversations with the area transits, and it was called the Public Transit Association. And we were going to present, and Carl was going to join us with that. But in the meantime, while we are on hold for that, Charlotte Area Transit, the person there contacted me, and we were able to get them 500 posters in English and Spanish, and they are putting them on all of their buses and trains in Charlotte. And so that at least has moved forward while we're waiting on other things to be rescheduled.
Outstanding. And I'll have to say this, we stopped at the rest area. We're actually at Lake Lure. Me and my wife drove up for the week to try to prepare for July 4th for just the family all being in a house, believe it or not. So we can't leave the house basically. But there was an individual reading one of our posters at the rest area for human trafficking. And I thought, well, if you put information up while people are standing around outside, they're going to read it. And that gets back to the same message that we had is, what if we have a kiosk or some kind of TV message? So we're still pursuing that. I think it would be a great way to let people know what's going on with human trafficking, and especially at North Carolinians. And the more that can read it and study it, the more they're going to report things that they see. And so we're working on that idea. It's still work in progress, but we're getting closer. And thanks to Christine for all her help for doing that. Another thing that we're working on was the PowerPoint with DPS and SBI to try to bring awareness to human trafficking for other law enforcements. So these are still in the works. We actually had some of the things going on. I know Carl's listening, and usually he's on there telling some of the things that's happening. I don't know if Carl can still hear me, but from an SBI perspective, Carl, can you You want to chime in on any of the things that you're working on currently that you can share that's not confidential? Okay, let's move along there. Hotline tips, calls, multi-agencies, MOUs. I think we're kind of getting more organized since Madeline was able to provide the data. It gives us a baseline to go with. And that's what we've been saying all along is how do we communicate with each other and how do we actually get data in that we can provide some kind of database. So what you're doing is so helpful and it's very important for us. And hopefully our Fusion Center, and if we can get more assistance to the Bureau at some point for positions, that'll be more of a favorable opportunity for us. So thank you on that. Some of the things that we have accomplished, you just heard Christine talk about some of our posters, awareness signs. We have the RDU airport that we're proud of. We finally got done and that's up and moving. They're still using it. Unfortunately, we had to cancel the Texas DPS training with the Highway Patrol due to the virus. This was going to be a great opportunity for us because we were actually going to train the criminal interdiction team with the State Highway Patrol and other sheriffs, deputy sheriffs with sheriff's offices across the state on human trafficking interdiction. But it went further than just interdiction. And once you made the stop, what do you do from there? And how do you investigate it? And how do you pass the information along? That's critical. Hopefully we can get back on the books. I think we may have some proposed dates, but we don't have them confirmed yet that I know of, so I won't share them yet. But we also had some emergency management meetings that we had to cancel in Cherokee, unfortunately, due to the COVID. So a lot of things got tabled. They're not done with yet. We're going to have them. It's just eventually at some point trying to make this craziness go away and we can get back to the normal. Some of the other things I want to discuss real quick was what we're hearing out of your report, Madeline, was actually that there are some labor cases out there that I was talking with Rick Hoffman in Johnston County, and he was advising he's starting to see a possibility of some cases come up in different areas across the eastern part. So Caitlin Ryland, if you're listening there, if you want to give me a call later, we can definitely talk. But there are definitely cases out there that we want to be part of if it warrants the case investigation. And we'll definitely have people, boots on the ground, that we can point you in the right direction to help you as well. So most of everything we're talking about is still very doable. I'm very positive. I'm excited about the future. And this is going to be the normal for us. So Christine, we're going to start using this for our committee meetings and get back to a normal meeting and have some actual input from what's happening in law enforcement and what they're seeing. And we're going to work real close with Caitlin's group, Caitlin Brooks's group with the legislation. If we need anything right now, I think we're seeing good things. That's a great report, Caitlin. Thank you for letting us know about the financial report for Human Trafficking Commission. So any questions? Christine, did I miss anything? I know I was trying to cover it very quickly.
I don't think so. Carl is actually still on the line. So I know he's part of Margaret's presentation, so we may have to do some tests to try to unmute him when it's time, but he is there.
Okay, very good. Well, I'll close with that. Any questions that I can help you with from the audience? And Christine, one thing I would like to see if we could talk to, that we discussed a little bit about if we could actually have some kind of email address that we could hear from our members or people that are out there that have questions for us, that we could actually get an email address that we can respond appropriate to. That'd be more transparent for everyone. And if they do have concerns or something that we can answer, I would certainly like to get back to anyone across the state that may contact us. So thank you.
Yeah, check into that. I'll check into that. That's a great idea, Mark. Thank you. As always, you have so much going on. And we all got sidetracked, but it sounds like you're getting back.
Trying.
Yeah, and did you say that you're in the mountains?
I am. I'm at Lake Lure right now. This is the first chance we've been able to come up here since probably February when all this started. So.
Yeah. Well, have a great time. It's a wonderful.
Thank you.
Next up, we have the Public Health committee with a report from Dr. Bernard.
Hi, everybody. Thank you again for everything that you're doing out in the community by abiding by all the policies that our leaders have put out. It's been a challenging time, as I'm sure you all have experienced. We actually had a meeting scheduled for March the 12th, but the brakes were immediately put on that. Given everything happening, my bandwidth became very small for anything other than taking care of hospital-related issues. We had countless meetings about things related to COVID, and it still continues to this day. But a couple of things that one of the things as a public health committee was talking, we were trying to get some buy-in from different hospitals and maybe get them to do some training, once we figured out exactly what we're going to go with. With everything that's happened with the COVID situation, I've noticed that a lot of hospital budgets, as others have, been pinched significantly. And so anything extra has been kind of cut out until they can see what's happening from a fiscal standpoint, which from a training standpoint makes it even more challenging for people to have access and to have people who are willing to take that project on. A lot of smaller hospitals are almost getting to the point where they may not even have enough money to operate. So adding something extra, unless it's something very simple, is going to be challenging. So that'll be something that we'll have to focus on, as we move forward, on making sure that whatever we do whatever we decide on training wise, it needs to be something simple, easy, and cheap. And one of our champions at Wake Med, unfortunately, has left. Kippy is now in a different hospital, but I think she'll continue to help lead the charge where she is. But I believe she's still in North Carolina, so she'll still be helping with a committee, hopefully. Haven't heard back quite yet from what her plans are. So needless to say, in the midst of the coronavirus, we have not had a chance to make a lot of headway, but had some things come up recently. Christine sent some information about some different training that's been available to try to pilot, and anticipate in the next month we'll be able to go forward. And I think our committee was starting to lean towards, in the very near future, recommending a specific training or a list of training options that would be available to different places locally. But we may have to change gears a little bit in terms of what we're going to recommend, given the financial constraints and human resources constraints that may be involved in our decision. So, I agree with Mark that this kind of meeting with the WebEx can be very helpful. I think that's how we're going to have to do it until we're allowed to convene in person. But I do think that some things that I've heard from Nicole was telling me yesterday about some data that she was getting about the number of people who are potentially trying to buy online. Potential people who could be being trafficked at this time may have gone up during this pandemic, which is very concerning. And so I think the urgency of getting things out there for hospitals to be involved, because they're one of other first responders is paramount at this point. So everybody's stretched. A lot of people who are going to be involved in the first responder standpoint have a lot of other things on their plate right now, but we do still need to keep this something that we push forward for a training standpoint. So I'm looking forward to getting back with our committee in the next month or so, and moving forward, getting what we need to get done for a public health standpoint and training.
Yeah, you're absolutely right. This is not something that needs to fall off of our radar during this time. And Dr. Bernard, I can't imagine what your life has been like over the past months. You or any of the first responders in any capacity. I'm thankful, and I hope that life gets easier. But thank you for your work just professionally.
Yeah, we're happy to do it. It's what we signed up for, and we're ready and willing to help. So things are looking okay on the hospital side for right now. So I'm hopeful that things will turn the corner here soon.
And you did sign up for certain things that I'm not sure that a lot of people realize specifically with what you signed up for.
Fair point.
Thank you, Dr. Bernard, for your service. Appreciate it.
Absolutely. No problem.
Really everyone, and Pam Cashwell, I think of you frequently over at DPS with the Emergency Operations Center. And how many days are we on that the Emergency Operations Center has been open?
It's funny, I missed the call this morning when Director Sprayberry gives us the count every day. We're well over 100 now.
Yeah.
So I don't remember what it is, probably close to about 110.
Yeah, I was listening on the day that we hit 100, and it doesn't seem like it was that long ago, but I have told several people in the past month or 2 or 3 that honest to goodness, I think that the hardest job in the entire state is Mike Sprayberry's job, considering all that the state has been through in terms of emergency management, hurricanes, storms, everything under the sun.
I definitely like to echo that. I think, sometimes people look at it more on the hospital side of, people getting involved with, the COVID situation, but there's so many people who get in contact with them before we even touch them, including EMS and fire department, first responders and police. And so, we couldn't do our job with what we're doing without them. So not only with the COVID situation, but with with human trafficking, it's going to be a collaborative effort where we can make a difference.
I mean, people had to pivot really quickly in how they were working with people and handling these things. So it's been an incredible. We have really good leadership, which I'm thankful for in North Carolina. So thank you again, Dr. Bernard, for your work and for that report. Next on our agenda is the Committee on Standards, and we did originally think that Monica was going to be here for her report. Of course, she is rolling off of the commission. She did send just a brief update, though, and asked that I read it for the record. So this is Monica's report. It has been my pleasure to facilitate our colleagues in developing standards for service delivery. The committee did a substantial amount of research, including reviewing standards from other states and soliciting feedback from current service providers in North Carolina. The committee compiled the feedback and decided, rather than create our new standards, to modify existing standards with the goal of gathering feedback from organizations that voluntarily implemented the standards to ensure they were specific to North Carolina. Once the commission was awarded state funding, we agreed to include the standards as a part of our grant program with the intent to utilize the lessons to modifying the standards. It is my understanding staff has collected some feedback, and I would recommend the committee request feedback from all grantees to inform the next iteration of the standards. Christine has been actively engaged in the standards committee work and has access to all the documents and resources. Therefore, I don't anticipate any problem moving this work forward. Christine, do you have anything to add to that?
I don't. It's been, we worked on these standards quite a long time ago. And so some agencies across the state have kind of tested them and piloted them. And so I've collected little bits of feedback, but I think as we restart that committee, we can look at, membership and make decisions based on everything that's been to this point. So I guess it's more just a chair moving forward.
Yeah, so Christine hit on the obvious next point of discussion here is with Monica rolling off of the commission, we will need to recruit a new committee chair for the standards committee. And we don't really need to come to any sort of decision on that right now. But I would just ask that you, if that's something that you're interested in, you think about it, you can touch base with me and Christine if you have an interest in perhaps taking that on for the commission. So just think on that and let us know. And then the final committee is the Appropriations Committee, which I had been chair of before rolling up to chair the commission. We had really been dormant for a while. The Appropriations Committee was created a couple of years ago when the General Assembly gave us the pot of money to issue grants. And as we finally appropriated or allocated all of those funds, we had been dormant for some time. We do have one grantee who has requested a significant a somewhat significant change in their in the term of their grant, and also just some things within the grant. I believed it was important for the Appropriations Committee to consider that request. So the Appropriations Committee consists of the chairs of all of our other committees. We have a meeting scheduled for Monday afternoon to discuss the matter of this particular grantee. My hope is that the Appropriations Committee will come up with a recommendation for the commission that we can bring before the full commission. My hope is to do that within the next week to 10 days so that we can make a final decision on this grantee. So just look forward to information from Christine and from me on this. Will hopefully be another WebEx quick meeting just to go over the recommendation put forward by the Appropriations Subcommittee. So that's it for our committee reports. And okay, Christine made a really good point. To kind of keep us on schedule and to keep Mark on schedule, we're going to switch around the next two things. We're going to go ahead, Margaret, if you're ready, and call you up for your presentation on human trafficking and the pandemic. Are you ready?
Yes, that's fine. And I'm going to turn off my video to make sure that I've got enough bandwidth to make this work. I've been having internet challenges in the last 30 minutes, so if I disappear, please don't take it personally. Christine, can you do the PowerPoint slides?
I can. It's going to take me a second to pull this up.
Well, we're going to talk about how the COVID pandemic has potentially affected trafficking, both in terms of how it happens or how people are responding to it. And your conversation has already gone in that direction, so it makes sense that we talk about this some more. The inspiration of sorts for this segment was a blog post I did for Coates Cannon a while back that was exploring how the COVID pandemic might impact human trafficking, and with my end goal being that as local government staff go about their regular work, they may, particularly if they're asking about vulnerabilities related to COVID, they may be picking up on indicators of human trafficking. Yeah, go ahead and advance it one more. And one more. That is just the reference to the blog post. And you all know there's the equation of human trafficking involves three kinds of participants, any of whom may be affected by COVID. And since COVID has pretty much affected the whole world, we can be sure about that. So the people who are vulnerable may experience different vulnerabilities. The people who are exploiting vulnerabilities to arrange and profit from the trafficking may do so in different ways. And of course, people who are customers of sex or labor trafficking may be accessing services in different ways. Next slide, please. In terms of people who are vulnerable, you know, the economic and social vulnerability overlap with risk of exposure to COVID, and it's not 100%, but it's certainly the majority, is my guess, of the two populations. I want to give a shout out to NC Stop Human Trafficking for their recent issue related to systemic racism and how that feeds human trafficking. Well, systemic racism probably feeds exposure to COVID as well because of the way people have to live and work. Next slide, please. Traffickers, as we all know, are highly adaptable to changing environmental conditions. In the blog post, I made reference to a couple of stories out of Texas, which said that trafficking through massage parlors was adapting almost immediately in a couple of different ways. One might be they appear to be closed, but really you can get in through the back door and have your appointment. Or the victims may be trafficked out of hotels or houses or something else. So they do adapt to changing circumstances. Next slide, please. Polaris came up with a blog post about how sex trafficking is still happening and how it might be changing. And one position they posited was that, we have to remember that with COVID, trafficking victims have even less bargaining power now in these unusual circumstances than they ever did, and that may well put them in more dangerous positions. And they also offered the theory, which I've heard in other places, that sex buying might simply be moving online predominantly. We would probably have no definitive numbers on that, but we have to be open to that possibility. Next slide, please. And here are just a few examples about what might have changed during COVID. There's new vulnerabilities, a lot more financial stress. We all know how that's a vulnerability that gets exploited, in part because of that, but also because of other reasons. Folks may have more unstable housing and be vulnerable to being trafficked to meet that need. There are probably new strategies for recruiting and marketing victims. Probably some of y'all saw the FBI webinar recently about how we're all spending more time online. Kids are spending a lot more time online, and that gives online predators more opportunity to build relationships with them and groom them for trafficking. And almost immediately back in March, I remember conversations coming up about concerns related to people who can't pay their rent and how landlords might abuse that vulnerability. And then finally, there are new or continuing risk of exposure due to the physical working conditions and the resources of victims. And I expect Nancy and Caitlin in a little bit will have plenty to share with us in terms of that as it relates to migrant farm workers. Next slide, please. So we're going to do a series of updates. Jasmine is the first one up to tell us what's going on with the Department of Justice. After Jasmine, we've got Carl Wall from the SBI who can give an update and also possibly respond to Mark's earlier question. And Christine's going to talk about what she's heard about from direct services providers in a survey that the Trafficking Commission did. And then Nancy and Caitlin will give us an update on migrant farm workers. And we'll just advance the slides when it's time. And when it's your turn, just unmute and share your update. So Jasmine, please go for it.
Thank you, Margaret. I did not know that I had the slide, so that's good. Christine, do I have other slides?
No, this is the one. Just out the flyer that you all made.
Okay. All right. Thank you. And Christine, do you have the one pager that you attached to the materials, or should I share my screen and share that?
I do have it. Let's see if
I'll talk for a little while you find it, if that works.
That is perfect.
So, as Margaret was indicating a little bit earlier, kids, mine included, hopefully not right now because I told them they had to clean their room first, are spending a lot more time online as a result of the pandemic and schools being out. And one of the things that you may know that our team at the North Carolina Department of Justice works on is public education around internet safety, and particularly the intersection of internet safety and vulnerable populations. When the human trafficking, North Carolina Human Trafficking, Coalition Against Human Trafficking, and NC Shield, and I believe Child Advocacy Centers of North Carolina reached out to us. We were in the midst of thinking about how we wanted to sort of shift a lot of our engagement around these issues online. And so it was very timely that we got together to work on putting together what is now on your screen, which is a one pager on helping keep your family safe online. It's not a ton of new information. It's information that, we've been sharing for a long time, but in a new kind of format, and, really tying this to what we hope can be helpful guidance and help for people as they try to keep their kids safe online, and in a way that I think we had a lot of conversation about how we don't want, parents to feel guilty about what is frankly, something that helps people to be on meetings like this and be able to get the important work done that they need to get done to really help improve our economy and keep folks safe, but also want to keep their families safe. And so we hope that this document helps move the ball forward on that. There's been a lot of outreach trying to get this document out to folks, and a number of press releases. And our team continues to do virtual presentations that folks can sign up for if they are aware of groups that would benefit from a virtual presentation about these topics by going to ncdoj.gov/outreach. So that's the project, and we appreciate being able to collaborate with some folks on this call and some not on this project, and are always looking for opportunities for collaboration. My team works on a broader way of public safety policy issues, and we think there's always a lot of intersection and opportunity for collaboration. Christine, should I talk about the other thing now, or?
I think we were going to do that in the commissioner updates, if that's okay.
Sure.
So next up, after Jasmine, will be Carl.
Okay. And I might have to see if we can guess at which phone Carl is. I guess I have to stop sharing my screen to do that.
Maybe Carl could tell us in the chat which one to unmute.
All right, Carl,
Christine.
did that? Yep, that worked. Okay.
All right. Yeah, just as far as an update from what the SBI, obviously, as Mark pointed out, March 13th, literally, we put the brakes on most anything that was not related to COVID or essential worker situations. So as far as the trafficking unit, we've actually pretty much done nothing. I hate to say that, but there's not been opportunities. We've had to cancel probably over 20 speaking engagements, and I want to think about 10 operations that we had set up through the last 3 months. And I know Nicole's going to speak on this, I think, a little bit later, but I think the vulnerability has been there and is up, as Margaret has said, and others, with children being online, adults being at home in front of a computer more often. But the actual tips that we've been receiving have gone down. And I don't know if that's because people are at home and they're not following through with the actual trafficking event, sex trafficking event, and they're just seeking stuff online. But it obviously has put a strong damper on what we've been trying to do, just because we know we're dealing with a vulnerable population to begin with, and not to put our agents out there in any more danger unless doing proactive work, unless, we get a tip and then we can respond.
Thank you, Carl. Christine, you were next on the list. You could share what you've heard from direct service providers in the state.
Sure, yes. I in the first 2 to 3 weeks after everything sort of shut down, I reached out, actually by email. We didn't do a formal survey. I just actually reached out to every group and provider in the state, whether that be direct service or advocacy group or shelters, and just checked in with them. And so, much of what I think I got back in response is not a surprise. A lot of them were shuffling pretty quickly to figure out how to start using online or virtual platforms to do things. A lot of them were having, if they were a shelter, to figure out how to space out beds and properly sanitize and do those kind of things. Some of the shelters, in fact, many of the shelters did hold off on admitting new people. A lot of programs I talked to were placing victims in hotel rooms as housing, temporary housing. And then, of course, the complication with that is that you also have to figure out how to get them their food and everything that they need in that hotel room during the shutdown. So lots of service providers just, it does sound like, have come up with great solutions and have been, I know, working their way through this. A lot of them are still transporting clients when they have to, or when a victim is found that needs taken somewhere. And then some of them have used contracts with transportation companies or places to do that for them. So the other thing that I will say is that a good outcome of this is the virtual side, and some of the things that we've learned about how we can do things more remotely with clients, and the telehealth visits that can be done remotely. A lot of that, I think, has been super positive to learn through this. Margaret mentioned some of the other items just about victims, survivors, losing their current employment or worried about their housing or mortgage or rent payments, that kind of thing. The other thing I will tell you, just to give you a little bit of what's coming up, and I know Mark's going to like this as well, but one of the things, Mark and Carl, but Madeline has worked on is she's taken all of the national hotline tips. And the tips from the national hotline, just to remind you, are made for law enforcement. So these are people that call into the national hotline and they want their report to go to law enforcement. And so Madeline has been doing some data analysis on those, and hopefully in an upcoming meeting we'll be able to feature that and share that with the committees. But it did look, actually just from that preliminary data, it looked like March and April were actually up from the last 2 years as far as tips, and then May looked like it went down a little bit. And so I think that data is going to be helpful to us in just knowing if our tips are being used and how best to use them and follow through with them. So look forward to that coming up. And that's all I have for my section, Margaret.
Thank you, Christine. Next, Nancy Hagan will begin the conversation about what's going on with migrant farm workers, and then Caitlin Ryland will step in as well.
Thank you, Margaret. And I'm going to do the same thing that you did because I've been bounced off twice. So I'm saying hello, and then I'll get off the video and onto audio. I always appreciate the opportunity to talk about issues within the farm worker community. I caution myself and all of us when we do this that it can be really easy to conflate labor trafficking in agriculture with labor trafficking in general. We tend to pay a lot of attention to that and forget about the 25 business models that are operative that Polaris has identified. But so why labor trafficking? Why will we focus on this today in agriculture? I'm going to give a broad brush, and then Caitlin will speak to specific issues that she's dealing with at Legal Aid. And one reason for addressing the many vulnerable communities, addressing agriculture, is that North Carolina typically relies or comes in at number 6, or 5 or 6 around the number of farm workers that we hire and use and employ throughout any given growing season. If you live in the Triangle, Charlotte area, it's really easy to forget how agrarian the state really is unless you're driving to the beach or passing through rural areas. But it's a significant industry, and so I think it bears this attention. I thank you, Margaret, for giving us that chance. So when I was thinking about what we were going to address, one vocabulary that I just wanted to include was that we titled this migrant farm workers, but there's really 3 kinds of agricultural workers. Briefly, seasonal workers are people who can return to their home at night and work during the day. So if any of you all grew up in the countryside and did farm work as a child, youth, adult, and went home at night, you're a seasonal farm worker. And you had perhaps some vulnerabilities but they're different than some of the other groups. Migrant farm workers are what lots of people think about. They are folks who follow a crop or a series of crops, do not return to their permanent home at night, but live in temporary quarters. In North Carolina, these first two groups can be either documented or have legal standing in the United States or not. And sometimes there are families where the legal status of different family members is distinct. And that's a really big vulnerability or potential point of intersection with human trafficking legal status. The third group, and I think Caitlin's probably going to talk a lot about this group, are what we call guest workers, and I put that in quotes, or H-2A workers. So it's folks who are here on a temporary non-immigrant visa. And North Carolina is one of the primary engines, both driving the increase in the use of H-2A visas throughout the United States and in employing folks. Those people tend to be in North Carolina, adult males, primarily from Mexico, although we do see some folks from Haiti and some from other countries. So their vulnerabilities might include low English proficiency, lack of cultural awareness. When I was talking with Caitlin last night to just discuss what we were going to say today, we discussed how these different forms of ag labor basically are embedded within systems where there are already gaps, systemic gaps and barriers, and COVID is accentuating those. So it might look different for a seasonal worker, migrant worker, and an H-2A worker. But I would say that with all of those groups, they're experiencing, and again, I credit Caitlin for some of these words, isolation, invisibility, and inequity. And we know traffickers or exploiters, they love to exploit those nexuses of vulnerability. So they're different in each group, but they're certainly there. They may include, in particular with the H-2A workers, they're the only employee sector in the United States where the employer has to provide housing. And they're also an employee sector where the employee is tied to a particular employer. They cannot seek employment otherwise. Their visa status is linked to the petition that the employer submitted in order to get them that temporary visa. And you can see that's where the inequity comes in. The power differentials between employer and employee are readily exploited under the best of circumstances, and even more so now in COVID. And Caitlin, before I turn it over to you, I just want to mention one other issue, and I think it was you, Christine, and maybe Pam who brought it up. We are in hurricane season. We know that folks are highly vulnerable when they're displaced, when their economic and basic needs aren't being met, and farm workers, again, are very vulnerable. They live typically in low-lying, isolated, invisible communities, can't be seen from a main road, are dependent on an employer for transportation, access to the outer world. Many of these areas don't have. If we're experiencing issues with our Wi-Fi and cell phone coverage right now, most of us probably rely on that access. Many farm workers have none or very limited or erratic access. So all these it's a confluence of factors, and there are a number of groups throughout the state that are trying to address them, and Caitlin and Legal Aid are one. Go for it, Caitlin.
Thank you, Nancy. I just wanted to take a moment to mention just sort of more undocumented North Carolinians in general. They're suffering the same COVID-related loss of work, health issues, transportation issues, isolation issues that all of us North Carolinians are, but they're not eligible for most COVID-specific benefits. So this pandemic has certainly exacerbated the financial reasons that already make people vulnerable to human trafficking. I think a lot of people know after our last commission meeting, just the immigration application processing times for trafficking survivors is at an all-time high. So trafficking survivors with currently pending applications for employment authorization don't have access to these benefits. And COVID has really created circumstances where
a survivor may have to return or depend on an abusive relationship or return to their trafficker for survival right now. Thank you for that very eloquent introduction. I think you really nailed it on the head, Nancy, just sort of talking about for migrant farm workers in particular, so people that are migrating away from their permanent place of residence, they're exceptionally isolated and have an unusual extent of their lives controlled by their employer, their pay, their housing, their access to mail, their lawful presence in the US often, access to information right now, which is very difficult, access to medical care, testing, medication, access to the store to buy goods, just to name a few of the aspects of their life that are normally controlled by their employer, by their circumstance. And then we have, you know, the 20,000 plus H-2A workers that are currently arriving, have been in North Carolina or are currently arriving to harvest our food and fiber this season. So under normal conditions, these workers fear reprisal from their employers for speaking up, you know, when they're experiencing issues around their working and living conditions, and COVID has just been exacerbating that. So we've heard reports from workers experiencing symptoms that are too scared to speak up for fear of losing their jobs or the jobs of their coworkers. We've heard reports that workers are not receiving information, paid sick leave, they're contracting COVID at alarming rates. That information is not currently publicized by DHHS, and workers are financially stressed. And imagine all of that in the context of, you know, potentially when your employer has charged you an unlawful recruitment fee and your family is indebted, or they've confiscated your identification documents. I would say the tips and cases that we're working on have remained steady, and even I would say in the past 2 to 3 weeks have spiked, particularly for human trafficking referrals. We have heightened concern with some new, like, COVID specific federal policies and state policies. So right now, during COVID, H-2A workers and other guest workers that would traditionally go through the consulate for an interview, and they would get a Wilberforce anti-human trafficking pamphlet with that Polaris number. They're not doing those interviews. They're basically turning in their passports, and then their recruiter is then going to Monterey, getting them their visa. They're traveling through Monterey to come to North Carolina, but they're not going through that interview process with consular officials. So they're not getting that number. Also, there are some emergency federal COVID regulations for H-2A workers that says that agriculture employers can recruit H-2A workers that are already in the US and have them begin working on new contracts that are pending and have not been approved by the government yet. So it's unclear what happens to those workers if that contract is found to be deficient or contain unlawful provisions and not approved. Also, there's no requirement that employers have to actually give workers a copy of paperwork showing that that visa extension has been applied for them. So we've had firsthand reports from workers where this has happened. They have no independent means to verify that an extension has been applied for them. There's no website that updates with this information. There's no phone number that they can call, and significant issues can flow from that uncertainty regarding your visa status, including manipulating a fear of deportation, maybe to prevent you from speaking up about something that's not, or even using that fear of deportation to compel you to work against your will. All of our traditional sources, like their access to information, are shut down now. So traditionally, advocates would combat that sort of isolation and invisibility through in-person visits to migrant labor camps through outreach. But that's almost completely shut down. There were a lot of groups doing like emergency aid drops. And there are some migrant health sites that do have staff to extend the clinics to those labor camps, but
4 of those organizations as of today now have either part of their staff or their entire staff are positive or under quarantine. And are waiting test results, which are taking in some places over like 70s to get those results. We caution that any guidance, no matter how well-intentioned, could have like disastrous consequences if it's not considering the really complex social reality that migrant farm workers are living in, and that is now heightened by COVID. So there's like one more concrete example that I could give you of how this can have an effect. Farm worker advocates, for example, expressed great concern when NCDOL published a memo with vague information, and then the Department of Agriculture then in North Carolina then published 2 letters, one in English and one in Spanish, about designating an employee to make bulk food purchases for the entire crew. These letters were distributed widely with no context, no guidance about all of the protections, federal, state, and regulatory, which apply to employer-involved food sales. And there is a long history in North Carolina of a common theme of employer-involved food sales in our history of wage theft, debt peonage, and human trafficking cases. And so this was really, really concerning. These letters kind of appeared that the state was authorizing or even encouraging these sort of employer purchasing plans. You know, this could be useful in some contexts, but unless it is completely voluntary, it could create a variety of problems and make workers vulnerable. And then right around that time, of course, we heard reports of H-2A workers living in a migrant labor camp who were told they were not allowed to leave the camp at all. So not able to enjoy the freedoms that, you know, I enjoyed under a shelter-in-place order to be able to go to the store and purchase my own food. And then they would have to purchase food through a supervisor. When they did not have enough money to purchase food at the supervisor's prices and not enough food was available, then they reached out in desperation to a farm worker organization, a faith-based organization, to do an emergency food aid drop. So I guess I wanted to provide that more concrete example to show, you know, when any guidance regarding employer control of yet another aspect of migrant farm workers' lives during COVID, such as a food sales program or restricting access to information or allowing employers or having housing providers to make a worker believe that they cannot leave a bad situation, it could be unlawfully used to constrain or exploit a farm worker during this time. And we are now seeing and getting reports of that actually sort of what we feared would happen is now happening. We have been open this whole time, and we've been receiving referrals, actually even from local law enforcement, SBI, direct service providers during this time, and we're trying to find creative but safe ways to respond. None of these organizations yet are fitted with sneeze guards for the like COVID environment, non-emergency medical transport. So it's creating a lot of issues. If someone needs to leave a bad situation, then you have to find a test and then arrange for transitional housing for them to sit in that transitional housing until they are then shown to be negative for COVID before they can then move on to their next safe place. And it's an added barrier to work with someone if they want to leave a bad situation or come forward. So thank you for that time.
Thank you, Caitlin. Your remarks certainly establish how intertwined these challenges are. Now, good news is it's my understanding that the Human Trafficking Commission has compiled some resources related to trafficking in the COVID pandemic that are available in the meeting notes. And you're all invited to share it on those. And then Jennifer, that is it for me. I guess we are open for the discussion as you have time to allow.
Absolutely. Thank you, Margaret, and thank you for all of you who shared specific information, Jasmine, Christine, Nancy, Caitlin. Thank you very much for everything that you all had to say. and just Caitlin, in specific response to the issue that you brought forward about the Department of Labor, you all are doing great work, and I thank you for all that you're doing. And Caitlin and I have had a separate conversation about this, and I think it is important to have context to how things are written, and I understand the concerns that Caitlin raised about that. And we're in a situation where we're having to sometimes react to things really quickly, and our mission at Labor is to protect the migrant workers and their housing. And I appreciate Caitlin bringing that to the group and bringing it to our attention. And it is certainly not our intent to cause any more anxiety around the situation. And we just continue to be committed to that. So thank you, Margaret. Thank you for everyone. Does anyone on the commission have any questions? Okay. In that case, thanks again, Margaret, and we'll turn it over to Christine for her staff report.
Okay, hello. So I will actually try to be brief because I know there's 2 more points that I still want to at least have time for today. So I did want to, most of the commissioners are aware, well, you all are aware that actually Nancy, that you just heard from, has been brought on to the commission as our training coordinator. And so this was our Governor's Crime Commission grant that has to do with training and technical assistance. And so I wanted to tell you just a little bit about her because I know many of you know Nancy, and we are just so lucky to have her join us here at the commission. So I wanted to let you know first that Nancy actually has over 20 years of experience on the ground working with migrant worker outreach and outreach to immigrant, rural, low-income communities through the Catholic Church. And then most of you probably know her from her recent work with UNC's Project No Rest. And so at Project No Rest, she has been able to have time or experience helping develop public awareness messaging and write scripts and helping to create videos, one of those being an illicit massage video that I know is excellent. During her role there, she also worked with helping with child welfare training across the state related to human trafficking and developing some of that curriculum and material. And so what she brings to us with the training and technical assistance really does help reach very broad. And I also wanted to let you know that one thing she doesn't tell you often about herself, she actually has her master's in counseling and psychology from Harvard and her PhD from Cornell in adult education. And so we are just glad to have her here, and she is getting settled. She just started last week, and you'll be hearing more from her related to the Human Trafficking 101 trainings and other things coming up. So other updates to give you related to the grant that just allowed us to hire Nancy as training coordinator. We also, of course, have requested some budget adjustments because, we always start Governor's Crime Commission grants late. And then with COVID-19, we actually started even later with actually implementing. And so we have some requests for contract revisions in some small projects that we want to just contract out in the next 3 months and try to get done. So hopefully those will be approved soon on both the Governor's Crime Commission end and the Administrative Office of the Courts end. The second bit of news to tell you about grants is that the Governor's Crime Commission had reached out to a few statewide victim entities that had particular years of grant money open, like our training grant, and offered an additional pot of money for us to use for doing public awareness and outreach type activities. And so we were able to apply for that. This money also has to be spent before September 30th. And so That grant is opening today or tomorrow. We've turned in everything and it's all been signed and everything. So you'll probably be hearing soon from us about that. There are 3 kind of components to that grant. One will be a video that Mark has talked about forever with the Public Safety Committee, wanting to have sort of just a video created that can be used in many different areas and platforms across the state. One piece of the grant will do with social media outreach and messaging across the state. We hope that we can tailor some of that, all of that messaging will be tailored towards victim identification, and then routing people to that national hotline number. But we hope we can even put some of that messaging as kind of reminding people that after disasters, we do see an increase in vulnerabilities and often an increase in human trafficking after natural disasters. And the third piece to that is actually a radio messaging project that we want to do with a Spanish-speaking radio station that we've gotten some quotes from. And so hopefully within the next 3 months, you'll be seeing lots of information about that, and we'll be able to roll out that campaign. The last thing I wanted to update you on is just, I don't want to skip over, because I do think coming down the line, a lot of what we've talked about over the years with our standards, and getting a gauge on who our direct service providers are and whether or not they meet the standards, and when and how we issue letters of support for grants and other things. We've had these conversations, and I do know that with bringing Nancy on as a training and technical assistance person, we'll be able to start making some movement in that area. But the UNC School of Social Work with Dr. Macy and others had invited us months ago to be a part of an advisory council. They have a grant with the National Institute for Justice. And it is actually the grant is to conduct an evaluability assessment and a formative evaluation on a human trafficking program that is actually in New York, a very large nonprofit program. And so I am able to be a part of that group and kind of follow along with things that I hope kind of feed back into helping us figure out how we can do this kind of thing better in North Carolina. The other announcement I wanted to make about that same team, Dr. Macy's team at UNC, is that they also just received a North Carolina TRACS grant, and it is for responding to violence victims during COVID-19, ensuring equitable access to diagnosis, treatment, and prevention. So that covers domestic violence, sexual assault, and human trafficking. And they are just getting started on that grant, so we'll be able to follow along with that too. And that's all I have for my updates. I'm going to turn it back to Jennifer.
Thanks, Christine. Does anyone have any questions for Christine? Okay, well, again, Christine, I want to echo what I said at the beginning. You have kept the wheels on the bus for us, so thank you for your work. And as we kind of get back to some of these things. In our last few minutes before the meeting is over, the last item on the agenda is just an opportunity for commissioners to provide updates on anything they want to bring to the commission, anything they've been working on. I am aware of a couple specific things that we want to discuss, so I'll bring those first. The first thing, and this is associated with Caitlin Ryland. At the end of our February meeting, we heard a presentation from the SBI regarding continued presence, and then at the end of the meeting, Caitlin presented the commissioners with a proposal to do a resolution in support of continued presence. I emailed that out to the commissioners shortly after the February meeting and just kind of requested some conversation around that, if that's something that the commissioners wanted to pursue. Of course, again, once March came, all of this sort of went to the back burner, and I apologize for not bringing this back up until now, but Caitlin and I have had a conversation about this, and I think based on the response that I received from my initial email back in March, I didn't hear anyone opposed to the idea of drafting a resolution. So I think first, I just like, Caitlin and I talked, and Caitlin is agreeable to drafting a resolution for the commissioners to look at and provide input. But I did just want to confirm that that's the thinking of the commission is to give Caitlin the go ahead on that. Does anyone have any thoughts about just asking Caitlin to draft something to take a look at?
This is Angelica. I would be in full support of it, and I appreciate Caitlin for her commitment in moving forward with this.
I support the draft as well. This is Jasmine.
Okay, Caitlin, do you want to provide, just talk to the commission about what your intentions are there as far as timeline?
Yeah, so I wanted to draft it with some help of my colleagues at Legal Aid, and certainly invite help from anyone who would like to provide some input into the initial draft. I wanted to make sure that we had multidisciplinary support in the language of the resolution. So I wanted to potentially reach out to our partners at SBI, and also provide a draft to the commission to review well ahead of the meeting. So you had a little bit more time than just a few days to take a look at something that we're all kind of new to reviewing. So my hope was to get a draft to the commission at least a week before the next commission meeting, but hopefully get a draft to some of our partners, whether those be folks working with immigrant survivors and direct services or legal services, or the law enforcement end shortly before that, hopefully maybe 2 weeks before the meeting, so that we can incorporate any feedback or changes and provide ample time for the commissioners to review. And also I wanted to just put out a call for if anybody wants to provide input, even if it's you don't want to review the draft, but you want to make sure that something's included, you can feel free to shoot me an email, and I'd welcome any help or feedback.
Thanks, Caitlin. And I just echo two things you said. One, that it's important that we get kind of all the stakeholders input into this, and secondly, that the commission has ample time to review it before we decide how to proceed on that. So thank you for taking the lead on that.
Thank you.
And I think, Jasmine, you're the only other one that I specifically was aware that you may have had an update.
Yeah, thanks, Jennifer. I wanted to talk to the commission about the governor's task force on racial equity and criminal justice. You may have seen that the governor announced this new task force a few weeks ago in an executive order. The task force will be co-chaired by Attorney General Stein, as well as Justice Earls of the North Carolina Supreme Court. And I'm leading the staff effort for this task force, and so wanted to make you all aware of that. The task force will be looking at a wide range of criminal justice issues and racial equity, including policing, but not limited to policing. Also issues related to fines and fees, pretrial sentencing, not sentencing, criminal trials and charging decisions. And so obviously value you all's input, and you should feel free to reach out to me with any thoughts that you have. I think that it's important in this moment to think about the ways in which various things intersect, as I was talking about before. I think human trafficking is also a racial justice issue. And I think there's a lot that we can take comfort in and hope in this moment from a lot of what we've been able to do in the human trafficking space and are continuing to do, as we think about the culture change that has been necessary for people to understand when people are trafficked, and the circumstances they might find themselves in, and how much of a partner law enforcement has been in that work. And so I take hope in that, and I look forward to partnering with all of you in this very important work. So thank you.
Agreed. Thank you so much, Jasmine. Any other commissioners share anything about what you're doing with your organization or your agency?
How much time do we have? Just kidding. Just kidding. Just kidding.
And we read about it every single day.
Right. Yeah, you all know what's going on with DPS. We're plenty busy, as if COVID was not keeping us busy enough at the EOC. Then when the various protests and rioting started, it just was like a whole new level. So I don't need to tell you what we're doing. We're busy, but we still appreciate everything everybody else out there is doing to help us push through this time.
Honestly, I'm just amazed that you found the 2-hour block of time to fit us in.
It's funny, yesterday I couldn't have. Yesterday was just completely, crazy. But today, the secretary is, I'm at Archdale today, and the secretary actually is here. It's probably only the second time he's been here in the last 2 months. He's covering another call that I was going to do with ALE this morning. And so I did get up at one point and go in there and say, what time are you leaving? Because we need to connect on, this list of stuff that we have to do. So it just worked out where it was doable today. And I'm really glad that it did. So it's good to see everybody's faces and good to see everybody is healthy and well.
I'm excited that we could see each other in this way, and I'm excited that our commission is full with too many members. That's great. Our next meeting is August 27th. It may be in person, it may be this way. We'll figure that out the closer we get to the end of August. Does anyone have anything else to say?
Hi, this is Angelica from representing NCCAT, and I just wanted to let you know we met last week and we brought on a new board member, Saida Estrada from NC Van. So we're super excited to have that voice at the table.
Great, thank you.
Christine, this is Billy. Can we get that date one more time in August?
It's Thursday, August 27th, same time.
Thank you.
You're welcome.
For Dina and Tammy, just know I'll be sending you all the calendar invites for the rest of the year, so you should see that as well too.
Thank you. Appreciate that.
Okay. Thanks, you guys. I hope you have a great Thursday and a great weekend, and I'll see you all soon.
Thanks. Have a good one. Thanks.
Thank you.
Safe.
You have just enough time on your battery.